Hello, hello. Welcome to the ASMR OBGYN clinic. My name is Lee, and I will be the one checking you in today. Did you make an appointment, or are you a walk-in? Yeah, no, we have availability right now. What's bringing you in today? You just kind of want a routine checkup, like a pelvic exam, or okay. And did you need, any specific things tested for? Are you concerned about anything? Some STI screening. Are you having any symptoms? Just being safe. Awesome. And all you needed was that pelvic exam, right? Okay. I am just making sure. And have you been to an OBGYN office before? So it's not your first time? Okay, I will let them know. Any prior experiences that we should be aware of that maybe didn't go so well? Do you need like a support person in the room with you? You're okay? All right, so we will do that. Now, did you want blood work as well? They could do a bedside, just because the swab and the blood work, they look for different things. Yeah, okay, no problem. And the provider will explain what's included in those panels for you. Alrighty, so I'm just gonna get some basic information to start up a chart for you, and then I'll get your vital signs, and then I'll leave you with the gown and stuff, and you can get ready for the examination. Yeah, absolutely. So let me just, can you give me your first and last name? Can you spell that? Okay, and what is your date of birth? Okay. All right. And do you have insurance at all? That's okay. Yeah, no, I could definitely give you the pricing if you're interested. And then any emergency contact you would like to have on file? Okay, and their number? Okay. Alrighty. And can I get your primary phone contact to go over test results? Okay, perfect. So let me just get the basic provider chart here. It's just going to have some of your medical history that we could review together. Any medical conditions that you are currently getting active treatment for? Okay. Is that just as needed? All right. And then any surgeries that you've recently had done within the past year? Any experience with anesthesia at all? Okay. And do you smoke at all, whether it be marijuana, tobacco, hookah, vape? And how long? How much would you say? Okay. All right. And are you currently sexually active? Okay. Is this a new sexual partner? Someone you've... Okay. Male or female? And any history of ever being told that you've acquired a sexually transmitted infection, whether it be gonorrhea, chlamydia, trichomonas? Okay. And as far as birth control goes, do you use any hormonal birth control, or do you use any non-hormonal like barrier methods, Paracord IUD? Okay. Is that all the time, kind of on and off? Okay. All right. Well, if it's okay with you, I think I got all the information I need. I'm just going to put some sanitizer on, and then we'll get your blood pressure, we'll check your temperature, and then I will let the provider know that you are ready for your exam. So let me just get this. Do you have an arm preference? Not so much. Okay. Alrighty. Okay. Let's do this arm. So you're just going to slide this in. There you go. Awesome. Is it kind of steady on you there? Okay, good. Give me 1 minute while I check your blood pressure. Okay. Pressure is normal. Let me take that out, and then I will take this off of you. Let's get that air out. And then you should be able to just slide your arm out of there. Perfect. All right. I am going to pack this away and then we'll do a temperature check real quick. Alright. Let me just rate your blood pressure here. Yeah, no, clinic's a little bit quiet today, so you came at a great time. Alrighty. These are, of course, sanitized after every patient. This is just going to go underneath your tongue. Okay, temperature's good. Let me take that off there. Let's put this back in. I'm going to re-sanitize, of course, because I just touched that. Alright, excellent. So vital signs are stable. So in all of our rooms, we already have a white drape here that's waiting for you. Honestly, you can just kind of use the white drape if you want to, considering it's just a pelvic exam. Or there's a gown here for you if you feel more comfortable just completely changing out of your clothes. Whatever your preference. There's no general rules here. Yes, you can keep your socks on. Absolutely. Keeping your shoes on, that might be a little weird, but socks, for sure, you can keep those on. All right. So, we've listed your vitals. I think I've got all the necessary information that I need. I will prep the end of the table for the provider to do that pelvic exam. The pelvic exams, you know, our definition of it is when the provider looks on the outside. She'll use a speculum, look at the inside of the vagina and your cervix. We'll do that STI swab for you, and then we can collect your blood work after. Yeah, for sure. Honestly, she may even collect blood work before the swab, just for like, yeah, for sure. Yeah, we'll see how that goes. Okay. All right. Yes, no, not a problem at all. So I'm going to leave a chart on your bedside table here, and then Leanna, the PA, should be in to do your pelvic exam for you. Yep, not a problem at all. If you have any questions, I'll be back at the front desk. For sure. All right, I'll see you. All right. Hello, hello. My name is Leanna, and I'm the PA that's going to be doing your full STI screening today. I figured maybe we start with the blood work and then I can get you set up for a pelvic exam after. Awesome. I just wanted to make sure that was good with you. So let me first put just some sanitizer, and then we'll put some gloves. Do you have an arm preference for where you want me to collect the blood? No? Okay. Just making sure. we're going to put these gloves on. And let me grab your sanitizing solution for your skin here. All right. So, if you want, we'll use this arm. So the first thing I'm going to do is I just want to sanitize the area here before we poke you. Do you pass out at all with needles? You're okay. All right. So lay out your arm for me there. Thank you. Perfect. And I'm just going to kind of clean off your arm here to make sure you're all ready for that blood draw. It's going to be a quick poke. Now the blood testing is for syphilis, hepatitis, and HIV, okay? Just making sure you know. All right. It's going to be a quick poke here. There you go. Just trying. Okay. One more vial here. Perfect. Okay. I'm going to be sending these out to the lab. I'm going to just put gauze here on you. There you go. Pressure, pressure, pressure. While I'm holding the pressure, the one thing I do want to explain to you is the CDC typically recommends against routine herpes screening, and that's because often with the herpes blood work, there's been a lot more false positive and negative rates than other types of STI screens. So unless a patient is high risk or maybe was had a known exposure to the herpes virus, the CDC advises absolutely against testing it. So that's technically the only thing that will be left off on today's testing. You're fine with that? Okay. All right. And then I will just apply a little bit of tape here and just kind of leave it there while we do your pelvic exam, okay? Yep, that was it. It was a very quick blood draw. So we'll send those out. And of course, I'll let you know if anything comes back on those. So let's get you situated then for a pelvic exam. I'm going to grab you a drape, because this one that you're wearing is just a little bit too short for my liking. So I want to get you another one just so you can kind of feel, you know, more covered. And you consent to an internal pelvic exam today, right? Okay, just making sure. So I'm just going to move you there. Okay, is that comfortable? Awesome. Okay. So we've got all our swab collection ready. This swab's going to collect for gonorrhea, chlamydia, and trichomonas. Okay, just making sure you're okay with that. And then you're also okay if we use a speculum, right? Yes, of course. We'll start with a smaller one. All right. So I'm just going to turn a light on here just so I can see better this general area. So give me a second here. And then we are just going to look on the outside first. You let me know if you get too uncomfortable at any point, okay? Awesome. You'll feel gloves here. Just looking on the outside to see if there's any suspicious moles or lesions. I don't see anything, and you haven't felt anything down there, right? Okay. Next up, we're going to take that speculum. We're going to place a little bit of lubricant on there. Okay. And then you are probably going to feel that cold lubricant and a lot of pressure internally, okay? All right. Again, let me know if you get too uncomfortable. Slow insertion. Okay. Everything does look healthy internally. I'm going to grab out that swab testing. Gonna feel a little bit weird. It's like a giant Q-tip basically. Now the ASMR OBGYN clinic, this process is way longer than real life. Just a heads up. All right. Everything's exaggerated for the sounds, as you know. Okay. We can package this up. Send that out. I am going to take the speculum out. Okay. And then the last part here is just going to be an internal exam with my glove to note for any enlargements or cervical motion tenderness, that sort of thing, okay? All right. Again, we'll put some more lubricant. I'm going to stand up a little bit here. You're going to feel cold. Any pain at all? What about when I do this? Good. All right. Well, I believe you're all done then with your pelvic exam and STI screening. Just to confirm, you're not having any urinary symptoms at all, or? No? Okay, very good. So these test results, the blood work will be back in less than 24 hours. The swab results may take a day or two. It looks like you're active on your My Chart, so you'll get notifications once your test results are in, okay? And of course, I will always call if something is not normal. Now, if the results are normal, again, you'll have access to seeing it in your portal. I will not contact you for a normal result, okay? All right, just want to make sure you're okay with that. Anyway, I am going to go update your chart in my little office. But other than that, we will be in touch. It's great that you came in for routine screening, even if not having symptoms, because honestly, majority of the times that we diagnose chlamydia and gonorrhea, these patients have absolutely no symptoms. It's just screening. So it's great you came in. Now, if you have a new exposure, it's always good to know that you should repeat your STI screening 3 months later, because not everything will always show up right away. Yep. Just like to give that little tidbit of information there. Do you have any other questions for me? You're okay? All right. Well, it was a pleasure seeing you. And if you need anything, you could always just call our office, okay? All right. I'll see you later.